Good evening, Austin Mayor Steve Adler. Got a minute? We're going to go over the numbers tonight, as we normally do the two dashboards, but this is Tuesday, so we have Dr. Escott's slides, so we'll be able to go in a little bit more detail for those of you that like data. The news to report tonight is that our area, our Austin MSA, is reporting a record number of new hospital admissions, a record number of new patients in our hospitals, a record number of hospitalized patients in our ICUs due to COVID-19. The numbers are increasing dramatically and geometrically, and we're in a crisis place. We're going to be taking additional steps to try to increase capacity, discussing those tomorrow. But for right now, this is a critical reminder that everybody in our city needs to do everything they can do to reduce the virus transmission in our community immediately. Let me show you the numbers so that you can see what we are reacting to. I'm going to begin with the key indicators so that you can see the numbers. Let me get you here. So here is the dashboard. We always start with the number in the left-hand side. Total number of people admitted to the hospital today, new admissions, 115. Remember in early November, we were down, I think, to a number that was, in the 12 range. We were trying to get to below 10. And then the number started going up, and it's gone up pretty dramatically. 115 people admitted to the hospital. Our 7-day moving average is 83. 83 then, the 7-day moving average number is what you see mapped out. And you can see we're well into the red range at 83. 115 would be off this chart. That's not the 7-day moving average. That's just what we had today. But we're not seeing that it's looking to abate at this point. New cases today on the right-hand side, 564. That is above our 7-day moving average of 518. If we keep having more cases and they're going up faster than and we're above the 7-day moving average, those new cases will translate into new hospitalizations. And those new hospitalizations will translate into patients in our ICUs and people ultimately that pass away. The number in the bottom left-hand corner is our positivity rate. It's listed here as 12.7, but that was before Dr. Escott got the correct number for the most recent period. Hasn't been changed yet. That number is not 12.7, it is 17.5%. In the last period, the number of people who have taken the tests in our city, 17.5% of them are testing positive. It wasn't that long ago that we had a positivity number in our community down around 5%. We were trying to get it to 3%, and now we're at 17.5%. We'll talk about positivity in the community and the percentages and what that means in terms of policy. The green numbers in the middle are the 7-day moving averages for hospitalized ICUs and people on ventilators. But let's go ahead and take a look at what the actual numbers were today in each of those categories. Let me pull up the other dashboard. You can see the number of people hospitalized in our hospital, the census today, 574. The 7-day moving average, 479. So we're almost 100 higher than our 7-day moving average. Number of people in our ICUs, 161. The 7-day moving average is 145. Remember, our hospitals told us that to plan on them being able to sufficiently staff 200 ICU beds. We're at 161. It's going up pretty dramatically. Ventilators at 99. There's a chance that we may be getting some help from staffing from the state, which would let us surge or flex past 200. We're trying to determine now if that's true, that we'll get that staffing, what kind of surge capacity that gives to us. But we are in concern, and we're in numbers that are dramatically increasing at this point. Remember that what we're seeing in terms of cases track behaviors that occurred a week to 10 days ago. People at our ICUs track the behaviors that we're seeing 2 weeks ago, which means that the Christmas holiday is probably the bump that we're seeing right now. Let's hope that the New Year's bump is not as great, because that would be added on top of the bump that we're seeing right now. That's the concern for the city. That's the worst possible case scenario if we get a New Year's Eve bump on top of the Christmas bump we're seeing right now. If people start now being a lot more vigilant with masking and distancing, avoiding large groups, then we see that impact in cases a week to 10 days later. I'm hopeful that after the first, we've been able to show a lot more discipline, and that we'll start seeing the numbers come down. But remember, there's a lag. Let's take a look at the slides from Dr. Escott so that we can see those. Let me see if I can get us to those. These are Dr. Escott's slides. Let me see if I can get a better view of those. Here's Dr. Escott's first slide. This shows you new confirmed cases. You can see the number that we just had. This was actually yesterday's number of 752. Today's number of 564 will be here, still among the 5 largest. This is the number of hospitalizations. The jagged line is the actual line. This line is the 7-day moving average. You can see that it's rising rapidly. You can see that ICUs also dramatically going up. Looked like it might have been leveling off, and then it goes up high. I think that's the Christmas bump that we're beginning to see. These are ventilators also going up way too high. This is an interesting map of Texas. These are the regions, the emergency regions that the state divides the state in. Each one gets a letter. Austin is in the region O that has a yellow X on it. The governor, when a couple months ago, when he was establishing his policies and raising the occupancy in restaurants and allowing bars to be opened, said that he was encouraging that to happen, but said if we got to the place where a city's number of hospital beds taken up by COVID got above 15%, that he was going to automatically be pulling back the occupancy in restaurants from 75% down to 50%. And he would automatically close bars. Now, he's talking about bars that are not masquerading as restaurants. In Travis County, the judge has never allowed bars to open, so we don't have bars open. But in the surrounding area around Austin, some of the other counties, bars are open. And if we get to the place where Region O is above that 15%, for 7 days, then those bars will be closed and the occupancy in restaurants will go down pursuant to the governor's order. When the governor issued that order, I'm not sure we thought that any of the regions would actually ever get above 15%. Most were significantly below that. But if you look at this map of Texas, the regions that are marked with a red X are the regions that have been over 15% for 7 or more days, and those occupancy levels have been pulled back, and those bars and those areas have been closed. The 4 regions with the yellow X are regions that have hit now north of 15%, but haven't done it for 7 days yet in a row, and that includes Austin. So we have now exceeded that number together with most of the other emergency regions in our state, and unless the governor closes them earlier, when we get another 5 or 6 days at this level, then Austin will be part of that group, and occupancy levels will go down. This is the chart from Dr. Escott that shows us hospitalizations by age. You can see 4 ages up here: orange, yellow, blue, and gray. Orange, yellow, blue, and gray. Those are the different age groups. This is 80 years or over. This is 70 to 79. This is 60 to 69. This is 50 to 59. Greatest percentage of people that are being hospitalized are in the older age groups, as you would expect. Smaller percentage of the mid-age groups in this grouping here. This is folks that are 20 to 29, 30 to 39, and 40 to 49. And then another grouping of 3 down here that are the youngest people in our area.
We're not seeing what you're showing.
And Diane tells me that you're not seeing this, so let me see if I can.
We see the first graph.
I'm sorry.
We see the first graph.
And that was okay. So let me see if I can. Let's try this again and see if we can get this done. Can you see this one now?
No, I just see your face.
You do.
Mm-hmm.
All right, let me see if I can.
See it. Now.
Oh, now you see it?
Mm-hmm.
Let me see. Can you see it better? There might be a lag in this.
Let's see.
This is the. So now are you just back to my face?
Yep.
See, I need my staff here to.
I'm sorry, I'm not very good staff.
No. To help me do this. Let's try this a different way. So you can see me now.
Mm-hmm.
I'm going to try to share my screen. Can you see that slide?
Not on Facebook.
You just see me?
Mm-hmm.
Okay.
Now I see something.
Okay, so let's keep it on here so that you can see these slides. We can see them. This is the confirmed cases, and you can see the numbers going up on the right. This next slide was the confirmed cases going up, also the ICUs going up, also the ventilators going up. We talked about that. This is the map of the state I was talking about with the regions. And you can't see it now?
I think you just need to describe it.
We could just describe it. Let's try this. See if this, we'll try one more thing to see if I can get you to see this, and then I'll just describe the slides. So apparently you can't see the slides, and I apologize for that.
They're there.
Okay, so here's the map of the state that I was talking about. These are all the regions with the red X's that have gone over the 15% for 7 days. The parts of the states that are yellow with a yellow X, including Austin, which is O in the middle, are above 15%, but not for the 7 days. So soon that'll be coming to us. This showed us the hospitalizations by age group. And there it is. In the top of the group, those top 4 lines are the 4 older groupings by 10, above 80, 70 to 80, 60 to 70. This next age group in the middle are the folks in the middle age groups, and then the youngest are down here. Hospitalizations by age. You can see that these were mixed up more earlier, but now as we get into the crunch period, it's really differentiating. So the older folks are representing a higher and higher percentage of the people in our hospitals. That is not good news because the mortality rate is highest among the folks that are oldest. So now we have a situation in our city where we have more people going into the hospital. A greater percentage of the people in the hospitals are older, and that does not bode well with respect to mortality. The next chart I'm trying to show you here is race and ethnicity. You see that slide. The top 2, the blue line at the top is white, non-Hispanic. Below that, the green line is Hispanic. This is African American, the white line in the middle. It's important to note here that hopefully what we're seeing is a trend that hopefully we can stop. But this is the Hispanic population that was down about its representation in the city, but now is rising. It's still below the percentage for white non-Hispanic, but it is a concern. If this number grows, then we would anticipate that to indicate that, again, the virus is hitting those folks that are most susceptible in a really disparate way. Among the numbers that are not showing us things that we like to see right now are the percent positive by week, and that's what you see on the chart now. You can see at one point we were down at 3.9, 3.8, 3.9 of the people that took the test showing up positive. As we talked about a second ago, we're now up to 17.5%. What this means is if you go out in our city right now and you get in a line at a retail store, or if you sit at a table next to somebody indoors at a restaurant, or you're queuing in line at an airport, or wherever you are, where you're around other people, the odds that the people that you are around are carrying the virus are much greater today than they were back at the beginning of November. And these numbers have continued to rise. This includes not just strangers, but it includes your extended family, and it includes your friends. That positivity rate at 17.5% is a scary number for us because it demonstrates to us that our virus is being spread in a pretty uncontrolled manner in our city right now. The next chart I have is the positivity, but positivity by race. 17.5%, scary number overall. Positivity among the Hispanic Latino community is now closer to 30% than it is to 20% in this area. You can see it was at 20. It's now risen to this level. Everybody's gone up. American Indians gone up. Asian has gone up. That's the blue. Black or African American has actually stayed kind of the same. We can see the Hispanic numbers gone up just the way that I described to you. This is Native Hawaiian, other Pacific Islanders. It's a small group. The white population below 10%, now above 10% at about 12%. But this number among the Latino community, positivity and testing is of real concern. And the fear is that leads then, after a number of cases, to hospitalizations. and ultimately to ICUs. This next chart is positivity broken out by age. And you can see that, and this is a concern, that positivity among people older, this is the group of people over 80, this is over 70, this is over 60, real increase here in the kind of the mid ages. Even if you are 30 or 40 and get the virus, even if your chances of dying are not great, the real concern with people getting it, as we're seeing now increasing numbers of people in their 30s and 40s, is the people that you give it to. The more people that are getting it in the 30 and 40 age group, the more people that are older that are going to come in contact with it, that are going to end up in our hospitals, are going to end up getting really sick and really in trouble. The reason that we decrease the number of outings and try to say fewer people should be going to restaurants for a lower period of the time is not necessarily because we think that you'll die if you're out and you catch the virus, but because the more hosts for the virus that there are, the longer it lives among us. And right now, what we're seeing is a pretty dramatic increase in positivity among people in kind of the younger or middle age group, which means we have a lot more hosts and carriers. This is really, this next chart, really kind of the only good news that we see. We were always afraid that we would have numbers that would, ICU numbers that would be really taxed in our city if we had flu. This is the chart that shows you how many cases of flu we had in past years. Last year is the red line. The year before that's the green line. The year before that's the yellow line. Our goal was to keep flu under 2% for this entire time so that they weren't filling up our ICUs. And in fact, that's what we are seeing. We are in stage 5. I would remind everybody of the stage 5 recommendations. Really try not to gather with anybody outside of your household to the degree that you can do that. Dining and shopping really limited to essential trips. Shop online, buy gift cards, support our merchants every way that you can, support our restaurants every way you can. Eat out, get delivery, over tip, buy gift cards, but don't go. Avoid non-essential travel. Businesses are recommended to operate through contactless options. This is the kind of behavior that we need to see. With respect to schools, remember that Dr. Escott had recommended that schools, the first week now back from school, that parents keep their kids at home. If you were traveling, you should quarantine for 7 days, test on the 7th day, and go back to school or work once you get a negative test. A lot of the school districts weren't able to take that recommendation from Dr. Escott because the TEA, the state, was penalizing schools if they worked in a way that just made it virtual or remote, but that does not mean that parents still have to send their kids to school. Dr. Escott, this is one of his slides, strongly recommending that parents transition their children to virtual education for at least 2 weeks as we now get to this higher place of infectivity. Those were all the slides from Dr. Escott. Yesterday, we talked about vaccinations, trying to get that out, talked about it for about 20 minutes. We're not going to go through that again. But I will tell you that the city of Austin, Travis County are trying to work with the state to get a significant amount of supply to us that we can get out quickly and equitably. In fact, we have told the state that if they get us a significant supply, that's exactly what we'll do. And as we look at our state and states across the country that are getting the vaccine in but not getting the vaccine in people's arms, that we would like the opportunity to be able to demonstrate that we can, in fact, do that quickly, do that equitably, which means primarily helping the folks that are at highest risk in the geographic areas where people are at the highest risks, which means basically focusing on East Austin, the folks that are most in danger of getting really sick and dying. Get it out quickly with an equity lens, focusing on populations of color, those living in poverty, areas where disease transmission is in the highest in those zip codes, those without transportation access. We're talking about potentially setting up a large distribution site, multiple smaller providers with limited access, getting it to people that have limited access, even putting it in mobile units and getting it to homes with people that are housebound. This is really crunch time for us. We're going to start seeing that ICU number go up even more dramatically from where it is right now because of the number of cases that we saw. And it's going to continue to go up. I hope that we are changing our behaviors now so that in a week or so we start seeing numbers go down. But that's the earliest probably that we're going to be able to see numbers go down, basically based on what we have already baked in. This is really a time where the community needs to fully appreciate the dangers and risks that we are currently facing. You know, there are cities that are further along than us. Los Angeles, for example, pass through, we are still continuing to rise. They're shutting down more and more things. And today, Los Angeles County Emergency Medical Services Agency told ambulance crews not to transport COVID patients who are unlikely to survive. We have to make sure we don't get to that place. The numbers are concerning. Please share that with your friends. Please share that on social media. Please make sure that everybody knows so that we're making the choices that can best protect our neighbors and our families. With that somber news, wish everybody a good night. Take care and be safe.